Are repeated thyroid biopsies always necessary? Imagine discovering a small lump in your neck and wondering what it means. Most thyroid nodules are harmless, but sometimes doctors need more information to be sure. That's where biopsies come in. A thyroid biopsy involves using a thin needle to take a small sample of tissue from the nodule to check for cancer. But do you always need to have this procedure done more than once? The answer is no. Repeating biopsies depends on specific factors, not a one-size-fits-all approach. When a biopsy is done initially, the results can be clear or sometimes uncertain. If the first biopsy shows benign tissue, meaning it's not cancer, most doctors won't recommend repeating the biopsy unless there are new concerns. For example, if the nodule grows larger, changes in ultrasound appearance, or if new symptoms develop, a repeat biopsy might be considered. On the other hand, if the initial biopsy results are indeterminate or show atypical cells, doctors may suggest a second biopsy or additional testing. This helps clarify whether the nodule is benign or malignant. Ultrasound imaging plays a big role in deciding whether to rebiopsy. Using systems like TIRADS, doctors assess features of the nodule, such as shape, margins, and composition. Nodules that look suspicious on ultrasound or are growing over time are more likely to be rebiopsied. Small nodules less than 1 centimeter without suspicious features are usually monitored with ultrasound instead of immediate repeat biopsy. Research shows that repeat biopsies can find cancers missed or unclear on the first try. However, they are not always more accurate than a single biopsy. The chance of finding cancer with a second biopsy is similar to that of the first, so doctors tend to reserve repeat biopsies for cases where there's a real suspicion or change in the nodule. In recent years, molecular testing has become a helpful tool. These tests analyze genetic markers in the biopsy sample to better predict if a nodule is cancerous. This can sometimes reduce the need for repeat biopsies or surgery, especially in indeterminate cases. Guidelines from major health organizations recommend a personalized approach. This means considering the biopsy results, ultrasound features, patient risk factors, and overall health. Routine repeat biopsies for all nodules are not advised. Instead, they are reserved for situations where the initial results are unclear or if there are signs of change. In summary, repeated thyroid biopsies are not always necessary. They are most useful when the initial biopsy results are uncertain, or if the nodule shows suspicious features or growth. Using ultrasound risk assessment and molecular testing helps guide these decisions, balancing the need for accurate diagnosis with avoiding unnecessary procedures. Always talk with your healthcare provider about your specific situation to determine the best approach for you.